Across the world, millions of people are visually impaired and a majority of them have low vision. Often, these defects remain undetected and uncorrected, thereby making blindness rampant the world over. This menace is not restricted to adults alone. Globally, millions of children are visually impaired. 90% of the world's visually impaired live in developing countries. In most of these countries, cataract is a leading cause of blindness. Unfortunately, India has the highest statistics falling prey to this disease. But there is light at the end of the tunnel. 80% of all visual impairment can be avoided or cured completely with the right treatment. The Chennai Vision Charitable Trust takes on the epic challenge of overcoming this grave problem with the ambitious Blind Free India campaign.
Rajan Hospital, a state-of-the-art eye hospital, was established in 1995, and since then our journey has been nothing short of challenging. In the year 1996, we launched the Chennai Vision Chariatble Trust, the community ophthalmology wing of the Rajan Eye Care, with the main objective of delivering quality eye care to one and all, irrespective of caste, creed and religion and socio-economic status. We have been working passionately in delivering the best of technology to the poor and the needy. Our main objective is to make available, accessible and quality eye care affordable.
The activities of CVCT have always reflected the emotional investment, in the sense that from the very onset, it was beyond the so-called realm of CSR. It's about the bigger picture of tackling blindness at its very grassroots and making life easier for the victims and their families. The idea was to take quality eye care services to the doorsteps of the economically underprivileged of rural Tamil Nadu. The project started with the 5 districts of Tiruvallur, Kanchipuram, Vellore, Tiruvannamalai and Viluppuram, as well as the economically weaker sections of the Chennai district.
Taking into account the prevailing situation, public health action is a need of the hour. Projections indicate that by 2020, an astounding 30 million people will become blind. As members of the medical fraternity and sensitized citizens, we can make a difference by taking immediate action to curb this problem. To tackle blindness at the grassroots level, it is important to understand what leads to blindness and how to prevent it. Our Blind Free India campaign is keen on doing just that. We seek to identify the different types of eye problems amongst the masses and provide suitable solutions emphasizing on both prevention and cure.
Chellamma is a 65-year-old woman who lives with her daughter-in-law Shenbagam and grandson in a village near Vellore. Her only son, Marada Pandian, was in the military and passed away a few years back. The only source of income for the family is the pension received in her son's name. Struggling to make ends meet, the women are not able to run a household, let alone tend to Chellamma's fight with the loss of vision due to cataract. For those like Chellamma suffering from cataract, CVCT has initiated a one-stop solution program. Free eye screening camps are conducted in the villages and city outskirts, wherein the people suffering from cataract are identified and then brought to the Rajan Eye Care Hospital by van. They are treated in the main clinic with free cataract surgery and IOL implantation. Along with their attendants, the patients are housed in the special ward and provided with the best of pre- and post-operative care, medication and food. The services further extend to aiding the patients and their families in adjusting with their regular lives after the surgery. Today, a child goes blind every minute. Refractive errors are one of the major causes for visual impairment in children, ultimately leading to a life in the shadows of darkness. 6-year-old Jasmine is unable to see the blackboard clearly. She used to ace her papers earlier but is failing her exams of late. Her teacher and parents cannot understand why this is happening to such a bright child. She's upset and confused, unable to explain her problem to her parents. CVCT's Refractive Errors Education and Prevention Initiative, that is the REEP project, is dedicated to preventing blindness in children like little Jasmine by conducting screening camps and providing free treatment for the young patients who, if detected at the right stage, can be cured completely.
Vision is something that we take for granted, but not many people are so fortunate. It's important to create awareness about corneal opacity and corneal blindness and the need for eye donations. Imagine, even after we have passed away, a part of us live on by giving this precious gift of sight. We seek the support of our community in our quest to eradicate corneal blindness.
The Rotary Rajan Eye Bank team works around the clock in their effort to make the Eye Bank an inclusive project for the entire community. Donation drives are conducted to support the process of harvesting of eyes and spread awareness. If about 10 pairs of eyes could be collected every day, out of about 100 deaths reported in Chennai itself, corneal blindness can be eradicated effectively in no time. Under this CVCT initiative, thousands of corneal transplant surgeries have been successfully performed totally free of cost.
நான் கெர்சியாவுடைய அம்மா முதல்ல இந்த படிக்கிற ஸ்கூல் மேடம் கண்ணாடி போட்டு தான் வொகேஷனல் பண்ணுவா. படிக்கிறதுலையும் அந்த வார்த்தையில் சொல்லணும். அது இப்போ இவ கண்ணாடி போடாமல் நல்ல வொகேஷனல் நல்லா பண்ணுறா. எங்கள் குடும்ப சூழ்நிலையில் நாங்கள் ப்ரைவேட்லலாம் பார்க்க முடியாது. இந்த ஹாஸ்பிட்டலில் எங்களுக்கு முக்கியத்துவம் கொடுத்து எங்களுக்கு இந்த ஹாஸ்பிட்டலில் ட்ரீட்மெண்ட் எடுத்தாங்க. இந்த பிள்ளைக்கு இது நிமித்தமாக இந்த ஹாஸ்பிட்டல் நிமித்தமாக இந்த பிள்ளைக்கு நல்ல ஒரு பார்வை கிடச்சிது. அதுக்காக இந்த சிவிசிட்டிக்கு இதுக்கு நாங்கள் தேங்க்ஸோ.
5th படிக்கும்போதே எனக்கு சுத்தமாக தெரியாது. அதுக்கப்புறம் எனக்கு சென்னை விஷன் சேரிட்டபிள் ட்ரஸ்ட் மூலமா இங்கே சென்னையில் எனக்கு ராஜன் ஐக்கரில் ஆப்ரேஷன் பண்ண பிறகு இப்போது என்னுடைய வாழ்க்கையில் நிறைய மாற்றங்கள் இப்படி தான் இருக்கணும் அப்படின்றதெல்லாம் எனக்கு உணர்ந்திருக்கிறேன். இப்போது நான் அந்த விஷன் வந்த பிறகு பிஎட் பண்ணுறேன். ஐ டொனேட் பண்ணால் என்ன மாதிரி நிறைய பேர் இந்த உலகத்தை பார்க்க முடியும். நிறைய பேர் உலகத்தை பார்க்காமே இரவும் பகலும் ஒரே நிலையில் நடந்திருக்காங்க. இதை கேட்குறவங்க கேட்டு மற்றவங்களுக்கு சொல்லியாவது ஐ டொனேட் பண்ணால் என்ன மாதிரி நிறைய பேர் பயனடைவாங்க, உலகத்தை பார்ப்பாங்க, அவங்களாலையும் படித்து ஒரு வேலைக்கு வர முடியும். அப்படி படிக்காட்டா கூட ஒரு கைத்தொழிலையாவது அவங்கள ஆர்வப்படுத்தி அவங்க ஒரு வாழ்க்கையில் முன்னடைவாங்கன்னு கெஞ்சி நான் கேட்டுக்கிறேன்.
Senthil, a second-generation marginal farmer and father of 4 from Poneri, grows paddy in his acre of land. During an eye camp in his village, it was revealed that Senthil is a victim of glaucoma, but due to the lack of funds, cannot afford treatment. Tamirarasi, a small flower shop owner from Acharapakkam, takes pride in running her own business. Of late, while stringing her flowers, she is unable to see due to reduced vision. This has been hampering her work immensely. She was diagnosed with diabetic retinopathy by a local doctor and advised to go to a big city hospital for treatment. CVCT is taking the next ambitious step of introducing Netravahana, the Blind-Free India project van, is the ultimate in mobile tele-ophthalmology. The customized design van is equipped with state-of-the-art facilities including fundus fluorescent angiography, retina laser, YAG laser and the latest computerized tele-ophthalmic unit. This van is a miracle van for people like Senthil and Tamirarasi. For setting up and sustaining Netravahana, a lot of funds and efforts are required. The Chennai Vision Chariatble Trust consciously looks at the future to better what is done today. The goal is realistic: to eradicate curable blindness. The possibility to a great extent depends on community support and participation. Endowments from corporate partners, donors and philanthropists from India and the world over will strengthen our movement and transform probabilities into possibilities.
Blind-free India means a happy and healthy nation. This will not only impact the social fabric, but also the economy of our developing country. Great opportunities to help others seldom come, but small ones surround us every day. So let's all participate in this noble endeavor of Blind-Free India.